Hi everyone, my name is Chahed Judewala. I'm a physiotherapist from Physiofunction, and today I'm going to do the level 1 class. And level 1 class is for people who are unable to move their arm or their affected leg, and you need a carer or a support worker or a family member with you to participate in this class. Also, all the exercises done in level 1 class are seated exercises, and you'll be using your non-affected arm or help from support worker. So these are seated exercises, and you probably it's a requirement that you need a support worker or someone with you whole time of the session. Okay, so please make sure before you go any further, you call someone. And today's class, what we're going to do is we're going to do two circuits. First circuit, we're going to do some exercises for your upper body, and then the second circuit, we're going to do some exercises for lower body. And between the circuits, we're going to repeat the circuit a couple times, and then between the circuit, we're going to do some exercises for some cardio exercises for upper body and lower body. Okay, I hope you enjoy it. So there we go. Okay, so the first exercise, what you do is you make sure you sit in a nice position. We're going to do a little bit of warm up initially, okay, before we start the circuit. So first, we'll work a little bit around the head and neck muscles. Sometimes, obviously, people at this level, they have been sitting in their chair for quite a long time. So it is essential to work on your neck muscles as well. So what we're going to do is we're just going to bring the head down, looking towards the floor, and then gently look up to the ceiling. Great. Nice and gentle movements. And then look back down again to the floor. Great. And then back up again to the ceiling. Great. Nice and gentle, very slow movements. And look back in the middle this time. Perfect. Okay. Now we're going to do side to side movements. Okay. So as if you're looking over your one shoulder, and then you tilt your head over that shoulder. Look away. You should feel nice stretch in these muscles. And then gently look back in the middle. And now you should be able to see on the other side. So tilt your head to the other side over the other shoulder. Great. And feel the stretch on this side. Look back in the middle. Fantastic. Great. We're going to do one more time on each side. Look onto this side and back in the middle. If you do this quickly, people can end up quite busy as well. So just be careful and do it nice and gentle. Great. And back in the middle. If dizziness is a problem, make sure you're very careful when you do these exercises or omit these exercises overall, okay? Now we're going to tilt the head onto, so you put your ear onto the shoulder. Tend not to lift your shoulder up because people can quite often do that to if you're unable to bring your head down. I've seen many people doing that. So just try to avoid those movements and just purely work on your neck muscles and just stretch out these muscles of your neck. Great. Back in the middle, nice and gentle. Now we're going to do leaning on the other side. Great. Stretch out gently. Perfect. And back up in the middle. Lovely. We're going to do one more time. Back down again. Great. And back to the other side. Now, obviously, some of the movements, if you're doing some movements on your affected side, then you might struggle. And if you are struggling with these movements, you can ask your family member, support worker, or carer, whoever is with you, to help you with these exercises. And what they can do is they can, so if you're getting your head down, they can gently and very gently give you a gentle stretch over the side to drop your head down. But if you're feeling uncomfortable, please make sure you let them know, okay? Because obviously it's your body, you know how things are. You need to inform them and you need to communicate well with them about how much pressure and how much stretch to apply, okay? Brilliant. Now look straight, nice and good posture, chest up, working on your core muscles, really making sure your core is nice and tight and sitting upright. What we're going to do is you keep your hand, if you want, you can use a pillow to keep your hand, to keep it supported. and we're going to work around your shoulder. Okay, so we're going to do some gentle rolls around your shoulder. Great. We're going to do that 5 times, rolling forward, and one more. And now we're going to do shoulder rolling back. Okay. Now again, it could be a difficult exercise if you're unable to move your arm and on your affected side. But remember one thing: working your non-affected arm is also very important. Okay, because that is the arm which you use a lot to do other activities. So it's good to do that exercises on the non-affected side. But on the affected side, again, your support worker or family member can help you with that. So they can hold your shoulder and they can do some gentle movement. But again, in a pain-free range and whatever is comfortable to you. If you don't feel right, make sure you let them know, okay? Great. So 5 rolls forward and then 5 rolls backward, okay? Brilliant, fantastic. Now what we're going to do is we're going to do some exercises for, we're going to start some exercises for the upper body, okay? So first of all, you're going to have, if you can do that by using your non-affected arm, that will be brilliant. Obviously, if you are struggling with that, or if there's any kind of shoulder pain, you make sure you let the carer know and they can do this exercise with you, okay? So first exercise we're going to do is we're going to bring your arm towards your shoulder, bending your elbow, and then bringing it down, okay? So again, as I said, I'm just going to grab a pillow. Brilliant. So you can use a pillow to comfortably support your hand, and then you bend your elbow and bring it down, okay? Great. We're going to do that 10 times. So that's 2, 3, 4. Great. Keep going. And remember one thing, you can always let your carers know how much movement to do if you've got any pain. So make sure that communication is going well with them, okay? Great. We're going to do 4 more. 7, 8. Great. Keep going. 9 and 10. Great. Perfect. Okay, so we've done that 10 times. Now the next one we're going to do is you hold your hand. So obviously, depending on how tight, how stiff your hand is, how weak your hand is, you need to alter your hand holding your affected arm with your non-affected arm. Okay, so you can either hold it this way, you can hold it this way if that's easier, or you can hold it around the wrist if that's easier. So just make sure. Otherwise, you can ask your family member or carer to help you support it. Sometimes, obviously, depending on what your sensations are like, it is very important to feel your arm. In the cool down, we're gonna do a little bit of work around the sensory feedback. So I will tell you about it. But also, it is good to keep touching your hand as much as possible. So your brain starts knowing the position of the hand, knowing that you're touching your hand, you're feeling your hand. It just helps building that pathways back again. And also, if other people touch your hand, like a family member or support worker, that is also good because you're getting some external feedback about your hand. So it's always good to do as much as touching and as much as sensory work around that affected arm, okay? So what we're going to do is you keep your hand here, and then we're going to do some straightening your elbow and your shoulder and bringing it back, okay? You're going to do that 10 times. Now, some people might have shoulder stiffness. So when you do this, your shoulder might be really stiff that you get pain. So be careful about that. Do as much movement as possible. And if your carers are doing this for you, make sure you inform them about the pain if you have. So just ask them to be careful. And if the carers are watching this, then I will tell them that continuously talk to the patient, talk to people about how much pain they have before you do this exercise, okay? Great. You're going to do that 4 more times again. Great. 1, 2, 3. Doing it nice and gently is always good. You can feel the stretch as well. Also, you can feel the movements, okay? And what I would suggest is when you're doing the movement, really think about you look at your arm, because that, seeing your arm, looking at your arm is very important. Your brain comes to know what that arm is doing. And sometimes many people might have neglect due to their stroke. So again, it is good to keep looking at that. if your family members are there and if you're listening to this video, then make sure you do tell them constantly to keep looking at the arm. Because of the neglect, they might be unintentionally not really attending their arm. It's called as inattention. So people might have that. So constantly telling them, telling them, look at your arm, see what arm is doing. Or probably another thing is you can give like tie a ribbon on the hand so it's more flashy so you can see it easily. Or give a colorful ball in the hand to hold when you do these exercises. So you can constantly look at that. It just helps you for brain to recognize that movement. Okay, great. So we're going to do that twice more. Great. And forward. Great. Fantastic. Okay. Now the next exercise we're going to do is lifting your shoulder up as much as possible and bringing it down. Okay. Now obviously, I'm not expecting everyone to go that high, but obviously if you can go, that's brilliant. That's fantastic. But some of you might just want to do this much because pain or stiffness might be limiting the movement. If that's the case, do that. Be comfortable, but really try to move your shoulder within the pain-free range, okay? Great, so we're gonna do that. Brilliant, and down again. Go up again, and bring it down. We're gonna do that 10 times again. Great, so that's 4, 5, brilliant. Keep going, 6, 7. If your carers are doing this, what you can do is you can hold the wrist around here. But obviously, many people can have a heavy arm because of some swelling or stiffness. And, it can be slightly, the carers or family member might feel a little bit nervous to move the hand or if it feels heavy. So what you can do is you can support the arm by keeping your one hand under the elbow, one hand here, and then move the arm up gently, but very nice and gently. And whenever they complain of pain, just stop there, okay? Great. So that might be something to do. And obviously, depending on how stiff your shoulder is, how stiff or painful your shoulder is, one of the things you can do is in the warm-up, your carers can do a little bit of soft tissue work, a little bit of gentle massage around the shoulder, or just, touching your arm around the shoulder just to improve the circulation, just relax the muscles a little bit. So that could be something done before you do these exercises, okay? So hopefully that should help. Great. And down again, perfect. You're gonna do that 3 more times. Brilliant. Great, and 1 more. Lovely, okay. Now, the next one we're going to do is you straighten your elbow and then you move it across. It's a little bit working around the core, but also around your shoulder and your arm, okay? Do as much movement as you can. Obviously, I can probably go as far as I can here, but you might not be able to do that. Or if there's any restriction, you might want to do whatever available range you have, okay? Great. So keep going sideways. Brilliant. You're going to do that 10 times. Lovely. I hope you all had a relaxing holidays and Happy New Year to all of you. I should have mentioned that before. Great. Keep going out. Lovely. Back in the middle to the other side. Great. We're going to do 2 more times on each side. Brilliant. So really, when you do this, it's, again, as I said earlier, it's not just for your shoulder, but also for your tummy muscles. So just when you do this, feel your trunk and feel your spinal muscles moving from side to side, okay? Because again, you've been sitting in the chair for, you probably sit and do activities quite long, or probably some people at this level are even like in the bed. So if you're doing these exercises and sitting, this is a good time for you to move about and to also relieve your pressure. So, when you do movement, you can even just try to lift your bottom up a little bit and just move from one side to other side, okay? So if you can do that, that'll be really great because that will relieve some pressure from sitting in the chair for a long time, okay? Brilliant, fantastic. Now we're gonna repeat the whole circuit again. So let's start with bending your elbow, great, and then bringing it down. So we're gonna do that 10 times. And as I said, you can use a cushion if you want to, but it's entirely up to you. Great. Perfect. Bend and straighten. Lovely. 3 more. Great. and down. Lovely. Okay, now the next one we're going to do is straighten your elbow and bring it back, okay? Straighten your elbow, bring it back, forward and back. Great. You're going to do that 5 more times. Brilliant. Great. Keep going. Lovely. And last one. Brilliant. Okay, now next one we're going to do is you keep your arm here and lift it straight up. Great. Or you can do it this way. Okay. Either way is okay. So you can do either this way or you can try to lift it up here. Okay. You're going to do that 10 times. Great. Brilliant. So one thing you can do is if initially in the first round circuit you did this way, in the second one you probably try to do this way. Okay, so you've done both ways. Great. Lovely. 3 more. Nice. Keep going. Keep going. Great. Fantastic. Okay, now you stay there, and the next one we're going to do is side to side rotation. Okay, you rotate to one side, back in the middle, rotate to the other side. Great. We're going to do that 10 times. Great. Brilliant. Nice rotation movements. Brilliant. Fantastic. And again, really focusing on your hand. So if someone feels dizzy, as I said earlier, some people might feel dizzy when they do head and neck movement. This is a really good way of working on your vestibular system as well, that when you are moving your arm, just focus on your thumb when you do this exercise. Or if your carers are doing this exercise with you, then you can look at your own thumb or your own hand when it moves from side to side. So it really helps with your vision following that as well. And hopefully it will help to reduce your dizziness. Okay, great. So side to side, brilliant. We're going to do a couple more on each side. Lovely. And one more on the other side. Great. And we're going to stop there. Perfect, fantastic. So now, the next one we're going to do is we're going to do 2 exercises, which are a little bit of cardio exercises for a minute each. So I'm going to put a timer. Great, okay. So I'm going to put a timer for 1 minute. And first thing we're going to do is we're going to do some marching on the spot. So again, for your affected arm, affected leg, see how much you can move, okay? If you can move even like a little bit, that's great. And you can work a little bit more on the non-affected side, okay? So just do as much movement as you've got. And really the more important thing is to work it at a continuous speed, okay? So let's start. Ready, steady, and go. Perfect, okay. So let's start. What you can do is if you're using a pillow, make sure you take the pillow off for this one so that you're constantly doing your leg exercise without having anything on top. Great. Perfect. If you are really, really struggling to move anything at all, or if there's a lot of stiffness in the leg or tightness in the muscles, what you can do is your carers can sit next to you, either on a stool or on the floor, and they can help you move a little bit of the movement, okay? Now, be very careful if you have got any hip implants or anything like that, okay? So in that situation, just be careful and don't move your leg up high too much, okay? Just very tiny movement should be okay. Great, so keep going. We have got 13 more seconds, okay? Brilliant. Perfect, keep going, keep going. Fantastic. Lovely. Great. Keep going. And stop there. Fantastic. Well done, everyone. Now, the next exercise we're going to do another minute is we're going to do some punching. Now, this is a little bit hard because we need to do a little bit more quicker movements. Now, depending on what the stiffness is and what your movement is like, you do accordingly, okay? But you can do it slowly as well. The aim is to do quick, but again, do it as per your abilities, all right? So if your carers are holding your hand to do this, you can certainly throw some punches or some jabs with this hand, by all means, because that is your non-affected arm, okay? So let's go. Ready, steady, go. Great. Perfect. Okay. So keep going. Now, if you are using your own arm, okay, or also under the supervision of your support worker or carer, you can do it this way and just keep going quicker a little bit. Obviously, if you've got pain, you can just reduce your pace. Okay. If your carers are using it, you still throw some jabs with this hand, and they can move this arm for you. Okay. And if you can't move the shoulder at this level, you can always punch a little bit down at this level, so that should hopefully ease off a little bit of pain. Okay, so there are a lot of variation around it where how you can do this. And if you find a different variation, please feel free to comment, leave a comment below. This is how you do it. Post your picture or something like that, so we know and we can always advise other people as well. I always ask for feedback so that it becomes easier for us as physios to know what people are doing, how they're doing, so we can tell other people. Great, fantastic, well done. Okay, so the 2 minutes are done. Now we're going to do some exercises for the legs. Okay, so what we're going to do is we're going to sit on the edge if possible. If you don't feel secure, if your sitting balance is not great, make sure you sit far back in the chair, okay? Or keep a pillow behind so that we can rest on it. My sitting balance is good, so I'm going to sit a little bit further ahead so you can see me as well. So what first thing we're going to do is you're going to slide your leg forward, just go back. So I don't know if you can see me. Great. I'm just going to slide my leg forward and then slide my leg back. Okay, so this is the affected leg again, and you just do that. So there are two ways you can do this, either with a support worker around you, and what they can do is they can help you move your leg forward and back. That's one way. If they are also struggling because of the stiffness in your leg, what they can do is they can put like a plastic polythene bag under your feet. So if you've got a slide sheet, put the slide sheet under your foot, and it just might become easier so that you can do it by yourself, or they can move it a little bit better. Okay, that's another way. If you want to do it yourself and your carers are there to help you or guide the leg, you can use your non-affected leg to bring it forward, then move it back and bring it back and forward like that. Okay. So a few ways again. So we do that for 10. We do that 10 times. Great. We've already done 5. We're going to do 5 more. Okay. Great. Perfect. So keep going and make sure while you do that exercise, you're nice and upright, constantly working on your core. Make sure you're not slouched or you're not leaning on one side, not leaning on the other side. You're nicely supported, working on your core. And once you finish the exercise, you can relax a little bit. But then when you're doing the exercise, really engage your core so that you're in a very active position. Okay? Great. Perfect. We're going to do once more. It's a really good exercise for this leg as well. I can feel it when I do this. I'm sure you can feel it as well. Great. Okay. Perfect. Brilliant. Now the next one we're going to do is we're going to do some side stepping. Okay. So what you do is, again, you can do the same way, the polythene bag or slide sheet under your foot, and then move it sideways and back again. Obviously, I'm using my both hands. You might not be able to do that, but you can always push it forward and back. Okay. If you can actively do that, that will be fantastic. If you can't, please ask your carers or support workers or family member to help you with that. Okay. Great. So we're going to do that 10 times. Lovely. Great. Keep going. Nice. Couple more. Good. And back. Fantastic. Okay. Now the next one is, again, for this one, make sure if you're sitting on the edge of the chair, you sit far back, because this might be a little bit, if your sitting balance is not great, I don't want you to topple over, okay? Because what we're going to do is you hold your hands and then you lean forwards and then come back, okay? Imagine a pen is dropped on the floor and you're trying to pick the pen up. But obviously, I'm not expecting you to touch the floor, okay? But it's just that whole movement we're going to do and then coming up, okay? If your sitting balance is good, you by all means can sit a little bit on the edge, not too much, okay? But a little bit away from the back of the chair so that when you do this, you are really in a good position. Okay, your posture is also good. Great, and lean forwards and come back up. Great, and when you do this, try to straighten, keep your elbows straight. Perfect, brilliant. Now there are two things you can do is again, if people do feel dizzy when they do this exercise, what you can do is you can focus something in front. So if you're watching the video, keep focusing on me, not a pretty side, but maybe I'm sure you can bear with it for a few seconds. Okay, or else what you can do is you can keep something flashing in front of you that you can look when you do this, so you don't feel dizzy. Or you can you can put something on the floor where you can look when you do this exercise, okay? This might be an option for people who feel dizzy. Great. And then come back up. We're going to do a couple more times. Great. And last one. Perfect. Fantastic. Now, just be careful if you've got people who've got hip replacements or anything like that. If you've got that, then just be careful how much movement you do, okay? Maybe another thing could be you can lean back a little bit more and then come back a little bit forward and then lean back more. Maybe that's something what you could do, okay? Now, the next one we're going to do is lifting your leg up, okay? Obviously, I am holding with my non-affected arm to lift my leg up. I've also got movements in my leg to do this, okay? But you might not have that, or there might be a lot of stiffness. Your carers can help you with this exercise, okay? Great. Perfect. So we're going to do that 10 times. Great. 7 more. 4, 5. Again, be careful if you have got any hip replacements, okay? Don't do too much movement. Just maybe lift up a little bit and down, okay? The main important thing is to work on these muscles in your groin, okay? Really, they are the muscles which really help you when you walk to lift your leg up, okay? Because normally people do walk from outside because these muscles are weak. So this might be a good one to work on. Just really work on the muscles, and once you feel like that it's working, just relax it down, okay? Great. The important thing is the facilitation of the muscles. Great. 3 more. Nice. And down. Lovely. Okay, the next one we're going to do, next exercise we're going to do is we're going to repeat the whole circuit again. So first one we're going to do is sliding your leg forward and back, and we're going to do that 10 times, okay? Great. Lovely. Great, keep going. Great. Again, whatever you used before, you can start using that. And actually, you might find that after doing all the 4 exercises before, your leg is a little bit more looser than before. So you might not need the plastic bag, or you might not need the slide sheet, and your carer might be able to lift it up a little because it's a little bit more relaxed. So that might be something, and you might not want to use it. If that happens, that's well and good, brilliant. You just need is more and more exercises probably. If that is not the case, keep doing it. There will be a point where you probably don't need the elastic, you don't need the plastic bag or slide sheet, okay? Great, we're going to do side stepping now. Perfect, so we're going to do that 10 times as well. Great. Fabulous, keep doing. 5 more. Great. Brilliant. Keep going. And stop there. Lovely. Okay, the next one we're going to do is 10 times. We're going to do bending down and up. Remember one thing, if you've got any hip replacements or metal hips, lean maybe backwards a little bit more if you want, okay? Try to avoid to lean down. Great. Perfect. Lovely. And down and back up, okay? Fabulous. Now the next one we're going to do is we're going to lift the knee up and down, okay? We're going to do that 10 times. And this is the last exercise before we do the 2-minute circuit, punching and marching, okay? So be ready for it. Make sure you have got a bottle of water with you during the whole time, so that if you need to drink, you have got something available. In this weather, it is hard to think about drinking water, but it's really essential that you keep yourself hydrated, especially now when all the winter bugs are so common, and along with COVID going on. So just keep yourself nicely hydrated all while of the exercise. If you need anything, pause it, drink water, and then restart again. Okay? Great. Couple more. Nice. And down. Perfect. Okay. Now the next 2 exercises we're going to do is for a minute each. I'm going to put the timer. Oops, I've got the timer already. And we're going to do that for 1 minute marching now. So hopefully doing all these exercises might have loosened it up a little bit that you can do with marching without much support, hopefully. Okay, so let's go. So do as much as you can. We're going to try and really engage that core as well. So try to sit a little bit upright. Another thing is, even if you can't move this leg up much, don't worry about it. Work with that leg, but then you can work on your core stability by keeping yourself upright, working on that core, not taking the back support. And that is also quite important, because for some people at this level, just working on sitting balance is really good. So you can go for that as well, okay? Great, keep going. Perfect, we've got 20 more seconds left. Nice. Great, keep going. Perfect. Last 5. And then after that, we're going to do some punching, okay? Great, okay. So now we're going to do a minute of punching. Ready, steady, and go. So hold your hands and then just punching. Great. If your carer is doing with you, you can just throw in some jabs with your non-affected arm and they can move it. Great. Brilliant. Keep going, keep going. Superb. Great. Brilliant. Nice. Keep going. We've got a few more seconds. Nearly 20 seconds left. Lovely. Great. So these some of the exercises for the upper limb or for the lower limb could be, apart from this level, could be for people who can walk but can't move the arm. So you might want to do some of the exercises from this level for your upper limb. Okay. So it's quite nice. They're quite really good exercises. And I have many patients who can walk but really have got weakness in their arm. So stop there. Great. Now we're gonna, brilliant, well done, guys. You've deserved a cool down period. Okay. Great. So we're gonna do some cool down. So for cool down, what we're gonna do is we're gonna get your cushion back. Okay. And what you do is you keep your arm on the cushion, nicely supported. And what I would do is I would hold the hand and then just really twist the arm back to palm facing up, okay? And then I'm just going to rub with this base of the palm. You're just going to rub on your forearm, okay? So palm is facing up, and you're just rubbing on your forearm. Because usually most of the people, this is the stiff hand, okay? This can happen, and these muscles out there can become quite a lot tight. I mean, for some people, even their arm can be facing down. So just really working hard on keeping that arm facing up will be a good stretch. Your carer can help you with that. If the carer can hold your hand this way, with your hand, you can just press it down, okay? Great. Now, one other thing you can do is if the carers are holding your forearm facing up, then you can just even work on your fingertips, okay? Just to gently push it down, stretch it out, push it down, stretch it out, okay? This is again a nice exercise. You can even use your thumb and just really work hard into that palm. I'm just gonna come a little bit closer to the camera so that you can see me a little bit more clearly. So you can work here, great. Perfect, so you can work into the palm. And then as I said earlier, you can really with your non-affected arm, dig into the forearm towards your palm and feel a nice relaxation in those muscles, okay? Great, okay? Lovely. Sometimes those muscles do need that. Okay, now what another thing is these muscles can be a little bit tight because people can be a little bit here, or I've seen many of my patients really tight. Most of them have got really tight these muscles. So it might be good to just rub your fingers into that. So really from the mid of your sternum going out towards your shoulder, okay? Again, a really good exercise, really nice stretch and some nice soft tissue work there. Great. So keep doing that. You can do that a few minutes, or if you can't do this with your affected arm, or due to any reason, your carers, I'm sure your carers can help you with this particular exercise, okay? Great. So that could be another thing, all right? Brilliant. Now, one of the other exercises the carers can do is really working on their shoulder, these muscles, so they can just really give a nice squeeze to these muscles. But again, when you do these things, please be careful if there's any pain or, some people do have subluxation around there. So just try not to pull the shoulder down. It's a nice way to just keep it nice and relaxed. And then, what you can do is if you've got subluxation is keep it relaxed so that this subluxation is minimal, and then really try to bring your shoulder up here, okay? Obviously, I've been working in neurology for so many years, probably past 10 years, so we've got quite a lot of knowledge. But obviously, if your carers are struggling or you are not conscious about this, don't worry about it. Do not do that. Just work on your forearm and maybe just work here, okay? But if you feel a little bit confident enough, you've seen someone done that with you before, this might be again nice exercise to do. Because again, for subluxed shoulder, you still need a lot of work around the shoulder. You need to strengthen those muscles so that the shoulder can stay in the joint, okay? Brilliant, guys, fantastic. Hope you all enjoy. I hope you all enjoy this exercise class for today, and I hope I'm sure Alex will be back in the next session, and from next week onwards. So I'm sure you can follow back on her classes. Unfortunately, she's indisposed today, so you stuck with me, but I'm sure she'll be back. So well done, everyone. Great class today. I hope you enjoyed it. Please make sure you comment below, and I'll see you next time when I see you. Till then, goodbye.